Hi everyone. I just want to say hello again, and I said from every Tuesday I will try to talk to you about the psychological aspects of the infertility patients. Last time I started off with the history of why I decided to go this route and why I want to do this specific study and why it's so important for me to learn a little bit more about the reproductive fertility treatment, and also to understand a little bit better about the resilient part of infertility. Resilience is the way that when you're in a difficult scenario and you must do something else to get out of that scenario, it's how you rebound and do something else to make it better for yourself. That's specific the explanation or a definition for resilience. Some people can do it, other people you need to teach them how to do this. Again, with the study, the most important part was for me to learn about myself a little bit more, to understand my own feelings, and then also to understand what's the reality of the psychological aspects, the things that we struggle with the infertility patients. So in this specific study, the first thing that I was looking at was the risk factors. Why is anxiety plays such a big role, and also why we do end up with such negative thoughts and ended up with the same symptoms as depression. The first thing for me is here, when you're anxious to do fall pregnant and you can't have it, the things that you think is so easy to have and try for it, it's suddenly something that you want to touch, but you can't hold it. And then also where it comes to a stage when the more and more you try, the anxiety is going to over to fear. You're really in a stage of, I fear to come for treatment. I don't want to go for treatment because I'm quite scared if I'm not successful. And then also where this anxiety turn over to fear, and where the fear is more getting in a panic, you panic really about it, and where it do effect on the negative thoughts completely. And I think that was one of the things that I really want to understand, what it is that you try so hard to have it, and why it's so difficult to let go of these treatment in the fact that you can't have a baby. Depression, as soon as you get negative about things, then it's really come to the stage where you feel completely helplessness, powerless, and you do have a lot of guilt feelings, all the typical things that is the typical symptoms of depression. So for me, the most important part was to go and have a look if that is the things that do have an impact on both men and women in the study. And then also what for me such important part is it something that we struggle pre-morbid, or is it something that's been activated while we're busy with treatment? And I must say, I do realize that in this specific study, the medication have a huge impact on the psychological well-being of the patients. So 45% of your patients that's sitting in front of you don't have the general symptoms of anxiety, general anxiety or depression at all. It's while you're busy with treatment, it really puts you more at risk, and where the fears and all these helplessness is coming along, the more the harder you struggle to have it, it feels like less on control of the things that you can do, and you get negative about it. I think here also such important thing that to understand that women and men do differ to these typical anxiety, depression things. Grieving is something that you handle both differently. So we can't say that men don't have emotional things. They do have, and they just react to that in a different way. I think that's for me such an important part, that both the couple is sitting here and understand, both partners in the couple, that they understand that we're going to handle it different, and it's different from men and women to each other. And the years, even if we do not struggle before we start with treatment, our medication could have a negative effect on our personality and the way that we handle things. And the years, if there's a family history of anxiety, depression, then I'm a little bit more at risk for that as well. So I think that's, for me, very important. Then also, I could remember how I've been so vulnerable in those days where, with the thought processes, you was quite okay in the morning, and then suddenly when you come to work, you see somebody else walk in the streets and that can't afford having babies, to have babies, and how you really realize, but shoo, it can't be true that, what did I did wrong, and you started with all these spiral thoughts of, why me, why not me, and what did I did wrong, and why can't I have it, and it's like the whole day it's put you in this state of mind. You can't get really rid of these funny obsessive thoughts that's coming to your mind the whole time. And so I went and see in the psychology department a guy, Charles Norkier. He was at that stage a doctor, and he said to me, okay, if this is one thing that you really struggle with during your treatment plans, then you have to look at people you call it more a warrior. You start to be a warrior. And when you are a warrior, then you start to engage with things like intrusive thoughts and uncontrolled and unwanted thoughts that's coming from nowhere, and you just engage with these thoughts, and it's be in your mind the whole day. And the fascinate of this specific study is how this correlates so well with anxiety and depression, where if you struggle more with these kind of thoughts and engage with them, it's also put you more at risk for anxiety and depression as well. And specific here, the guys did actually even worse, on the scale when we tested them before they started with treatment. I think also very good in this stage is to realize that there's different reasons why women struggle to fall pregnant, So the polycystic ovarian syndrome patients are more at risk for depression, anxiety, and these kinds of thoughts, because there's already a hormone imbalance. And with treatment, it's even they're doing less to compare to maybe to your general population in the infertility group. Then also, endometriosis. I mean, it took almost 7 years for patients to get the diagnosis. So the psychosomatic symptoms, they're not 100% sure. It's something that I feel in my head or in my body. So they also do struggle more with anxiety and fears and uncontrolled thoughts than to compare to your general population, the general ones, and in this specific group. Right. And again here, just coming back, this is why we just call infertility the disease of the unemotional roller coaster disease, where there's a lot of ups and downs and things that you engage with that you never thought could cross your mind, but it's there. I also could remember so well one of the feelings or thoughts was crossed my mind was jealousy. The one, I'm not a jealous person. I actually like to make life for people better, and I'm a giver. I want to give something to somebody else to make life better for them as well. And suddenly it's like, I explain it, jealousy is like, I don't want to hear other people when they do fall pregnant. I don't want to be there when they go for sonars, or when there's deliveries, and it was like a little bit of feeling of jealousy of them. I don't want them to have it, and why can't I have it? And then suddenly to realize that it's not something to feel guilty about. It's not your fault, and we have to take it from here forward. So for me, this session was specific to summarize. Just to all the infertility patients out there that if you struggle with these thoughts, just to tell you that all these psychological aspects, the risk factors and the thought process is just such a normal process that we're all going through, and that we must be very careful that we not start to be a blaming game between men and women, husband and wife. And we do grieve differently, and we go differently through processes. And if we can get through this, 1 out of 2 of us marriages sometimes does not make it, but if we can grieve and actually growing closer to each other, this relationship is such a strong relationship, and we're going to make it for the infertility treatment. The next part that I'm going to tell you next week is, for me, the ones that I actually want to talk about is the resilience ones and the narrative goals that you can put out there. How can I really make my mind change or look at these things differently and come around where we can let go some of these parts and realize that we can believe there is a hope and also realistic expectations about treatment. And we're going to talk about the different causes of infertility. Keep well. Bye-bye.